Good morning. My name is Brian Wheeler, Director of Communications for the City of Charlottesville. Welcome to Cville360, a program to inform and engage the Charlottesville community. During the coronavirus pandemic, the city's leadership knows you want to hear from us frequently about our actions. We also want to hear from you and provide opportunities for engagement. We've launched this program on our streaming sites, Comcast Channel 10, and on a companion Zoom webinar, so you can tune in live and on demand while practicing social distancing. The webinar allows you to join the broadcast and ask questions of our guest. If you want to try the webinar, visit charlottesville.org/Zoom for the registration information. A link to each show appears at the bottom of the page. At the top of each show, we'll have a brief update on the state of the coronavirus and the city's response from the city's fire chief, Andrew Baxter, who joins us today in studio. After the chief's update, the remainder of today's program will focus on our local school division and their approach to delivering everything from meals to lesson plans to diplomas during this pandemic. We have a panel of 5 leaders from the Charlottesville City Schools, including Superintendent Rosa Atkins, all joining us via webinar, ready to share information and to take your questions. On the webinar, you can type your question in the Q&A module. You can click the raise your hand icon, and I'll bring you onto the program to speak directly to our guest. Well, let's start with Chief Baxter. Welcome, Chief.
Good morning, Brian.
We've been taking these opportunities 2 times a week to ensure that our residents have access to information and city officials who are on the front lines of the coronavirus response. You were also in a town hall last Friday. So first, let me say thank you for being available and for taking on any questions that might come your way.
Absolutely.
We appreciate you putting yourself out there.
Sure, absolutely.
Where do you want to start today?
So I think start where we usually do with our strategy, which is unchanged, providing essential services to the community and protecting our most vulnerable populations and protecting our first responders and really all of our other essential workforce that's out there, our CAT drivers, social services, human services, everybody you can think of that human infrastructure that's supporting our city and our ability to deliver the most basic essential services for the community. So we're still focused on that and refining how we do that in this new environment. So for example, what kind of PPE do you provide for someone who's cleaning a workspace? That's a new environment for us, and we're working through all those details as they come up and trying to stay ahead of that curve. I think it's also important to, something I try and do regularly is reflect on how quickly this has evolved. And so just as a reminder, March 12th was the local emergency declaration and the governor's declaration of emergency. So just a little over a month ago. And if you think back on everything that's happened, it's really amazing the amount of planning and the amount of work that's been done to get us sort of reoriented as a community in this new environment. And then the first executive order 53 was March 23rd, and then executive order 55, which we're under now, was March 30th. And then so the next thing I would share is the data. So our snapshot is from data released yesterday afternoon at 4 o'clock by the health district. They release that information now every Monday, Wednesday, and Friday. So in the health district now, we have 185 COVID positive cases, and that includes 6 that are clinically diagnosed, meaning they're exhibiting the signs and symptoms of COVID-19, and they were living with or had close contact with someone that they know had COVID. Unfortunately, we've had 6 fatalities in the health district, and that's the awful part of this disease, and we certainly extend our condolences and our thoughts and our prayers to the families and the loved ones of those that have fallen to this disease. In the city, we currently have 34 known cases and then 53 in Albemarle County.
Great. As always, a lot of new information is in front of us for each show. But what can you tell us about what's happened in Fluvanna County, and how does that situation inform our response in the city and county?
Sure. So Fluvanna is one of the counties in the health district. And we're up to 62 cases in Fluvanna now, and as folks have probably seen on local media, there's been an outbreak at a licensed care facility, a skilled nursing facility in Fork Union, Envoy at the Village. And so they've tested everybody at the site. There's a Virginia Department of Health task force that's fully engaged with the facility leadership and the folks that work there. They were able to do rapid testing of the entire facility, which is something a month ago that I don't know that we would have had the capability to do. And then VDH is directly supporting the facility with additional personal protective equipment and other types of support. At our regional level, at our regional EOC, which is city, county, and university, we've reached out to offer some support and some guidance where we can on our outreach efforts and the support that we're providing to our licensed care facilities in Albemarle County and the city of Charlottesville.
And, you know, we think back to in the state of Washington when one of the first major outbreaks was at an assisted living facility.
Right.
And we've had some issues in Albemarle County as well. So why is that particular environment a concern?
Sure. Well, first of all, you have a very high-risk population to begin with, particularly in a nursing home environment. You think of the reasons why someone is in a nursing home. They're elderly. They have pre-existing medical conditions. They may be recovering from an injury or a stroke or some other hospitalization. So they're very, very at risk for any infectious disease, but certainly a viral disease that has, we're sort of still trying to figure out an effective treatment for. That's one of our highest risk populations. And then you add to that the fact that they're living literally in the same space, and the folks that are taking care of them are going from patient to patient. So it's really sort of a perfect storm in a way of vulnerable population and an infectious disease, and then the sort of the engineering of the space is what makes that such a complex and high risk setting. And we saw in Virginia very early on in a facility in western Henrico County, which was not dissimilar in how it played out to the facility you're speaking about in Kirkland, Washington.
If you have a question for Chief Baxter, feel free to type it in the Q&A module of the webinar, or you can raise your hand and I'll bring you into the conversation. Chief, one of the things we learned yesterday was there's a team of computer scientists at the University of Virginia working in what's called the BioComplexity Institute. And let me just start by saying I'm so glad that our hometown has a BioComplexity Institute at this time. But they shared a new model of the pandemic's trajectory, and it was intended to be a decision support tool for public health officials. The governor talked about that yesterday. I'd like to put up on the screen the key findings from that report and have you talk a little bit about those with the audience.
Sure. So I think the most important thing to reinforce, we know that reinforcing good behavior or positive behavior has sort of an exponential effect on people's behavior. So the most important message, and you can see that's highlighted in this slide, is the current social distancing, or as Dr. Bonds refers to it as physical distancing efforts. Those are working, right? We know this. We knew this beforehand, that anecdotally that this would work, and we now have some proof that this is working in terms of creating a sort of a pause in the growth of this outbreak. So that's excellent news. We also know that based on those projections from this model, it looks as if the hospital system, the healthcare system in the Commonwealth as a whole will have the capability to treat people that are infected with COVID and require hospitalization if this trend continues, if this pause in the rate of rise of this disease continues. And that's critically important. The further out that peak occurs, however high it is, gives us more time to build the systems and the capacity in place, whether that's testing or hospital capacity or ventilator bed capacity or EMS capacity or nursing home capacity, to be able to absorb however high that spike gets. One of the other critical messages, and this is a local conversation, a state conversation, and obviously a national issue as well, is that if we lift the social distancing restrictions too soon, we could have a second wave, and it's possible that second wave could be worse than the first wave.
Let's look at the graphic that shows some of those waves over time in these different models. We'll pull that up next. It's a complicated slide, but I think the community is getting used to seeing these peaks and valleys. But obviously on the far left is if we don't do anything, if we're
Right.
not taking care of business.
Right.
We have that terrible spike
Right.
and a lot of cases. So these different scenarios where these scientists are saying, keep doing what is working, keep the physical distancing efforts going,
Right.
that pushes out the peak number of cases. And, coming back here in the studio with you, Chief, I think the thing that's been interesting is watching those dates change. At one point we were talking about a peak in May. Last week we were talking about a peak in April. Now we have another set of data that's tuned into Virginia's
Right.
cases, and it's saying if we keep practicing these methods, we may not see a peak till this summer.
That's right.
So is that for those who are stressed about working and living in this environment? I know that's not easy news to hear, but tell us why that's good news.
It's good news because it gives us time to ramp up the capabilities in all of the various settings. For us in public safety, for the tertiary care environment at hospitals, for testing. One of the areas that we're still really challenged by is community-wide testing, right? And that's a huge logistical challenge. And so the more time that we can have to address each of those issues, whether it's hospital capacity or ventilator capacity, staffing, testing, things like discharge planning is something that we're working on at a regional level. So, when someone's in the hospital, they get treated, they get well, where's the appropriate place to send them, right? Particularly if they're a high-risk individual. There's complexity built upon complexity here. So the more time that we have to deal with each of those complexities, the more likely it is that we'll come up with a good solution. The other element there too is also, in terms of logistics, is personal protective equipment, right? So we're counting on the supply chain of much of this equipment, much of which is manufactured in China and other Asian countries. That supply chain has to get sort of rebound from its current shock state, and the longer, again, that we can delay this peak, the more likely it is that our providers in the field and in the hospital setting and primary care settings, nursing homes, will have the PPE that they need to be able to successfully treat patients and limit the spread of the disease.
Great. As we finish up this segment, anything you want to add, Chief Baxter?
Yeah, I'd just like to reemphasize that the social distancing, the physical distancing is working. We need to keep doing that. The hospital capacity, it sounds like we're in pretty good shape. People are working very, very hard. And then the next thing is the recovery strategy. We're working on that as a locality. We're working on that as a region. We're doing that with great intention because we know that we take very seriously the messages that we get from the scientists about the risk of sort of lifting the lid too soon. So we really want to be intentional about how we do that, how we reopen various parts of, for example, city government. How do departments work in this new environment? And we're trying to balance, the public health needs versus other challenges, economic and social. And there are consequences, real consequences to people being isolated for long periods of time. My 85-year-old mother yesterday was asking if she could go for a drive. So that's a challenge for us, for our family. How do we make sure that she stays connected? Right. And everybody's family is going through those same challenges right now. So just encourage people to stay positive and stay connected. And if they have questions, ask questions. And please go to reliable sources for your information.
Chief Baxter, thank you very much for all the work you're doing.
Absolutely.
Appreciate it.
Thank you, Brian.
Next, we're going to switch to a discussion about city schools. And we've got a great panel ready to speak with you today. And we're going to start in the studio with Dr. Atkins. But let me first introduce everyone we have. We do have Dr. Rosa Atkins, our superintendent, and each of you could wave, that'd be great. We have Kim Powell, assistant superintendent. We have Jeff Faust, director of technology. And we have Gertrude Ivory, who's a consultant. But I know her as a former associate superintendent from my time on the Albemarle County School Board. So welcome, Gertrude. We'll start in the studio, she's not in the studio. We'll start on the webinar with Dr. Atkins. And Dr. Atkins, a month ago, the governor ordered schools closed for 2 weeks. He later extended that closure to the remainder of the school year. How are you doing? And what has this month been like for your team?
Brian, I will tell you that we have we embraced the closure of the schools on March the 13th, and immediately our teachers and our principals and our staff went into action to think about what are the cascading effects of having to move from face-to-face to online learning and online connectivity. I want to applaud all of our teachers and our administrators and our staff. They've done a remarkable job navigating territory that we have not been in before. It's stressful, it's difficult, but under those circumstances, our team has done a great job.
Excellent, thank you. One of the first things I heard about when I heard the schools were going to be closed, one of the first questions I heard was, how are we going to feed our students? And so maybe, Kim, we can bring you on. They're accustomed to getting nutrition at school, and now suddenly that pressure's on the homes and to provide not only supervision but sustenance. What can you tell us about the meal delivery operations the school has undertaken?
So it's been a challenge, but we the governor announced the initial closing for schools on Friday, March 13th, and we were pushing out into the community by Tuesday, March 17th, and that day we fed 644 students, and the numbers have been increasing ever since then. Now we routinely see over 700 students, 700, 800 students every time we go out. We go out on Mondays and Wednesdays, and on Mondays we routinely distribute over 2,800 meals because we're providing breakfast and lunch for Monday and breakfast and lunch for Tuesday when we go out on Mondays. When we go out on Wednesdays, we're routinely distributing over 4,200 meals. So we're putting out over 7,000 meals a week. And we do this by a combination of what we currently have are 5 fixed meal distribution sites, and then we're running 5 bus routes. And each of those routes have 3 to 6 stops. So we're really trying to spread out through the community and get as close to the students and families as we can. And I feel like it's making a difference because yesterday weather is one of the challenges we face in this process, and yesterday was the worst weather day we've had. There was downright deluge at one point, and in total we only served like 50 meals less than what we've been serving despite some very wet weather. So there are a lot of parts of this process that have been very uplifting, just getting out in the community and seeing and connecting with our families. Our teachers really, we have lots of great volunteer support, but our teachers are almost fighting to get on the volunteer list because they relish these opportunities to get out in the community and just see their kids face to face instead of just seeing them on the computer and connecting by phone and things like that.
Thank you. So the webinar allows people to ask questions of our panel here. Feel free to raise your hand or type a question into the Q&A module, and I will ask that. If you have not joined via the webinar, you can still do so at charlottesville.org/Zoom. And at the bottom of that page, there's a link to each of our programs. You can register and come on via the webinar. Talking about webinar and technology, let's bring Jeff Faust on. And Jeff, I think of our educators as being on the cutting edge, early adopters of new communications tools. After all, they're trying to keep up with and engage, what we call digital natives. So talk about the Chromebook Initiative and what the city has been working on.
Sure. So I could not agree more with you, Brian, that our teachers are innovators and leaders and really on the front lines of technology adoption and its integration into good, high-quality education. So we've been pushing a one-to-one initiative since 2012 in Charlottesville. Most recently, we're in year 2 of a 3-year adoption of Chromebooks that go all the way down to 3rd grade. And so what we started with was taking advantage of the fact that our high schoolers and middle schoolers take home their devices and already have devices assigned to them that they travel with on a daily basis. That accounts for about 1,700 devices. And what we did when we first started to recognize the opportunity here and being able to leverage the technology to provide lossless learning without, boundaries or limitations of the classroom or the physical building, was we started to push those same devices out to our upper elementary schools. So 5th and 6th grade at Walker, and then 2nd through 4th grade at our elementary schools. We distributed another 1,000 devices through those distributions. And we're actually getting ready for another distribution today, this afternoon, at all the elementary schools for grades K and 1, where what we've been able to do is take some of the carts and the devices that we have available for classroom use that are shared in schools in carts, and make them available to our families that don't have a device or something for the students to use to connect with their teachers and learning at home. So that'll happen today. We estimate, all said and done, we'll probably put about 3,000 to 3,100 devices out into families and households in Charlottesville, for them to be able to stay connected and keep learning during this time.
And what's your expectation about how many students then would not have computers?
Our goal is 0.
Okay.
So between our teachers and our parents and our principals, everyone's sort of beating the streets right now and letting people know that they just got to let us know. We have people across the division driving and dropping off with a no contact drop off at curbside and to doorsteps, and we're getting devices out there. So the goal is 0, and I'm pretty confident that we can get there.
Great. Well, we have meals, we've got laptops. Let's bring Gertrude Ivory into the conversation and talk about how a school division pivots to online instruction. Gertrude, tell us about your multi-phase approach.
Well, good morning. First of all, I want to thank our healthcare workers who are out there taking care of all of us and hopefully staying healthy themselves. And our CCS teachers and staff, our instructional staff, our central office staff, they have worked really diligently to respond to the landscape in which we find ourselves right now. We began this, Dr. Atkins gave us a charge. There is no way in a virtual environment we can replicate what happens in the face-to-face environment. So we took the governor's order when it was issued that we're closing schools. In the beginning, we just wanted to get our students and families familiar with the technology, get our teachers familiar with it, try to establish a routine for them at home, first of all, so that they could focus on their own well-being, because right now people have fundamental life issues that they're concerned about. And secondarily, they're concerned about continuing the learning. But since that's our charge, we wanted to be sure we had a continuity of learning plan that was responding to what our students are going to need as they go forward for the next year. We're not focusing on grades. We are focusing on the learning, and we're not focusing on SOLs. We've been given a reprieve for the SOLs for this year. We are focusing on getting our students prepared to move to the next level, knowing that we're going to be closed for the remainder of the school year. So with the tools we have in place, some of our teachers are very technology savvy, and our 5th through 12th grade teachers and staff have hit the ground running with what they need to do. Beginning yesterday, we began introducing our students to new work based on what was not covered up through March 13th. So they're focusing on those that information that they'll need to be ready to move to the next level next year. We started with a paper-based program for our pre-kindergarten through 1st grade, sending in the mail learning packets to those families so that the students could stay engaged, help our families with a daily schedule, a routine to address the learning opportunities and activities that we were providing for students. And then from 2nd through 12th grade, we definitely have an online learning experience for our students. It's not virtual learning in the purest sense. We call it emergency remote teaching right now, but our teachers are definitely getting into that, and we provided a lot of support for them because we believe that everybody is a learner. So in addition to what our students are learning, we're providing some support for our teachers so that they will be able to navigate this new online environment with their teaching activities and learning activities. And then our kindergarten and 1st grade students with technology devices because they use them in the classroom, so they'll be able to continue, and their teachers will steer them into some of the activities that are available in the virtual environment so that they can continue their learning.
Excellent. Well, we've got a couple questions related to technology. Adrian Dent wants to know, is the school division making plans for remote or virtual instruction for next school year? Who could address that question?
I'll be glad to take that one. Twice a week, I'm in contact with the State Department of Education, and Dr. James Lane provides us information on that he's getting from the governor's office on the modeling and the forecast for the peak and the severity of the situation, the coronavirus. And we know that the situation is dynamic. So as we become more accustomed to the online learning and starting to think about moving beyond a state of emergency in our delivery of instruction and starting to think about what might be our next route of instructional delivery, I think it's going to be prudent for us not only to plan for face-to-face contact, but also to plan for what might it look like should we have to continue the online learning. Gertrude Ivory did mention that we're not concerned as much about grades now as we have if we would have been face-to-face. However, as we start to think about what learning might look like during the summer and well into the fall, those are considerations that we have to take into account as we plan. What will it look like to deliver online learning? What would it look like to grade online? So that's on our list of the planning that we're doing now, starting to think about. It would be prudent for us to have a plan A, that schools would reopen and we would go back to something that looks closer to our traditional model, but also have that plan B, that what would it look like if we have to continue with, and schools will not open and we have to continue with the online learning. We should be prepared, and we are preparing for either A or B.
So we'll come back and we have another question for Jeff Faust, and I'll get to that in just a second. After Jeff addresses that question, we'll show a brief video from the school division which talks about the issues related to grades and how courses are going to be counted and completed this year. So we'll take this question and then we'll watch that video. Jeff, Melissa Stepp wants to know, is it no longer a case that there can only be one Chromebook per family?
Yeah, so when we first started the distribution, we were focused on making sure that we had enough devices to go around. At this point, a family that needs more than one Chromebook for their situation, their setup, they should just contact their local school. Where we are right now, we're confident that we have enough to cover K-1. Based upon the numbers, what we've been able to do at this point is basically calculate what we're getting as far as showing up and or families that need. And so based upon that, we know that we have a certain amount of inventory, not sky's the limit, but I would ask for that parent just to contact their local school, go ahead and make the ask. And I've gotten 2 principals already in the last couple of days that have asked me the same question. The answer is, given the situation and given the need, the answer is yes, families can have more than one if they have more than one child. But again, when we run out, we run out. And so that's what we're trying to do, is make sure we get at least one per household before we start filling in more than one per household.
Thank you. We're going to watch a brief video now from the school division.
We all know in school, 2 ideas sometimes get mixed up: grades and learning. We worry about grades, but it's the learning that really matters. This spring, we have enough to worry about, so we are not going to worry about grades in Charlottesville City schools. We are going to keep things simple with a system similar to pass-fail. We'll call it A or incomplete. Schools closed on March 13. If your student had earned a passing grade at that time, then we will award them an A for the course. If your student was not passing then, we will offer clear steps for them to learn the essential concepts of the course and earn the A. While the grade will appear on the transcript, it won't be included in the GPA. We picked this system in part because traditional grades are not meaningful under the circumstances, and pass-fail grades are sometimes penalized in situations such as scholarship applications. We also thought an A or incomplete system would be a relief in a stress-filled time. For juniors who have questions about what this means for their college applications, know that as we made this decision, we talked with top universities. Our letters of recommendation focus on student strengths, not grades. You have always shown us your strengths, and you can do that this spring too. So let's recap. We are not stressing over grades. We are not worried about test scores. The state has received a waiver from SOLs this year. What's important is preparing our students for next year. That brings us to learning. After spring break, we are going to start covering the key ideas and concepts that our students need to master in order to succeed next year, whatever next year means for them. As we teach new material online, we will focus on helping students keep and grow their skills, maintain their relationships with friends, teachers, and schools, and add to their overall well-being. Students, invest in your learning now so you'll be prepared for next year. There's still a lot to work out, and we know you'll have questions. Even we have questions. Even the state has questions. It's a very unusual time, and we will work together to find answers. Just know that as we seek answers, we will always focus on our students' and staff's best interests and well-being.
I thought that was a really great rundown on how the city schools are addressing the grading issue. And we've got a question from the webinar, and we'll see which of our panelists wants to address this. With the grading decision for this year, would that mean current 9th graders will be starting their 10th grade year without a GPA? Who could address that?
Also, and it does. That's exactly what it means, that the GPA for our current 9th graders will actually start in their 10th grade year. So we wanted to move in this direction because of the stress that all of our families and our students are under currently, and to take that one stress off of them. And our top universities and colleges have assured us that they will understand and will work with us as we navigate these waters. We're also looking to have a statement on the student's transcript that will give more clarity to our grading and our system for this period of time.
Thank you, Dr. Atkins. And I imagine it must help that every high school student is in the same boat throughout the country when it comes to dealing with issues like this. But I think back to my children when they were in 11th grade, that seemed like a particularly stressful year. They're thinking about their futures, they're thinking about their transcripts, AP courses, and things like that. What is the school division doing to help manage that process for the 11th and 12th graders who are looking at college and looking at graduating this year?
College Board has given us information about actually the online version of the AP exam. So I know that there are a number of our families and students who are concerned about the AP testing. So that is going to be an option for our students, that online exam. For our dual enrollment students and teachers, we're working with PVCC to implement the model that they have designed for closing out the school year and awarding credit for those courses that our students are taking. And we continue to work with our counselors. We're working with our admissions offices in many of the colleges and universities. And we are not alone in this. It is happening all over the country, and the admissions offices are working with our students. So we want our students to rest assured that we are setting up a scenario in which they're not going to be penalized for the grades and the work that they're doing this year. We will structure it so that we work hand in hand with the colleges and universities, and there will be no penalty for our students.
I want to bring Gertrude back. This morning, the Daily Progress had a story written by Catherine Knott about some of the different approaches being taken by other school divisions in the region. And for example, Louisa County focused on printing materials and distributing that to families. And it sounds like different school divisions have taken different approaches. What can you tell us about why that is and how that's maybe informed the city's approach?
I think that has to do with the resources that are available and the just where their school division is in regard to having devices available for families. One of the things we have to focus on in this landscape is making whatever we do as equitable as possible for our students. So here in the Charlottesville City Schools, we're very fortunate that we had devices that we could deploy to students from second grade on up. Our second through fifth grade students are very familiar, second through fourth grade students are very familiar with technology tools as they use them in the classroom. They didn't take their devices home. Our fifth through 12th grade students had an individual device that they kept with them all the time. They were able to take those devices home, so they're very familiar with that. So we were able to quickly move in the direction once we made a plan to distribute the devices to our students in second through 12th grade to make sure that they had a tool available to them, either through their families or through what we provided to them. And then they were able to continue their learning in that manner. Our pre-kindergarten through first grade students used technology devices in the classroom, but they had not used those on a regular basis. And while they used certain programs, that wasn't the core of their instruction. So we decided that a paper-based program for pre-kindergarten through first grade would be the best route for us to take. And we wanted to make sure that our students got those, so these were mailed to the homes. We also have a plan to put those in some key places in case people didn't get them in their homes, and they'll be available. They can certainly pick them up from their school just as they're picking up the devices. But we had to look at the equity issue, and I think that's what school divisions are looking at. How do they provide instruction in the most equitable way possible for our students, given the challenges that we have at this particular time?
And, a question for Dr. Atkins, speaking of equity, what student populations are you most concerned about during the pandemic?
Brian, of course, equity is first and foremost on our minds, and we're concerned about all of our students, but certainly those students who may not have internet access, students who may not have parents may be working, they may have younger siblings at home who are also in school, who are engaged in online learning, and an older brother or sister is providing the day-to-day care while parents are at work for those siblings in the homes. So we're concerned about students who find themselves in that predicament, who are looking to make sure that they get their meals each day, that they have breakfast and lunch each day, that they have all of the foundational necessities in order to get through a day in a healthy way. So for all of those students, we are being very intentional on making connections, getting materials in their hands, but also providing for those students the emotional and social support that they're going to need in order to continue to be successful in school and to navigate this particular time.
And while I've got you on screen, we have a question from Amanda Burns asking if some type of credit will be given to students who are working at this time or in the summer. Can you talk at all about the types of credits students would receive?
That's great. The students on March the 13th who were not passing their course, so as they go through the continuity of learning modules, those modules will represent the work that will help them to move from the incomplete that they would be awarded if they were not passing to successfully completing the class as represented by the A. For our students who were already passing, what we want them to do is engage in the continuation of learning modules, which they're going to find on their device, and teachers will make them aware of that. And by engaging in those modules, students are continuing to develop and hone their skills of perseverance, digging deeper into content matter that they may have already mastered, but going deeper and learning how to apply it in different ways, and to also have that independence with managing their learning. and gauging the time that they're going to spend in that learning. Those students, those skills that they'll be developing at this time will serve them well post-secondary and well into life. So it's an opportunity for all of our students to grow in various ways.
And Brian, if I may, I want to reassure our students. Can you hear me?
Yes, go ahead, Gertrude.
Okay, I'm sorry. I want to reassure our students and our families that while we're grading students at the high school, not in the traditional sense, but while we're assigning an A or an incomplete, the response that they get based on the work that they do will be feedback. And we're hoping our teachers will give that feedback as lovingly as possible. For example, we will be clearing up any misconceptions students have when they demonstrate, after they've completed a learning module, when they demonstrate their understanding of that module. If there are any misconceptions, the teachers will give them feedback. So they will not be getting a response to the work they do in the traditional sense. If they complete the work, go in and do the activities that are requested of them, receive the feedback, talk with their teachers, then they will be successful in these courses going forward. So I don't want them to be nervous about whether or not they will be able to navigate the learning modules that we have prepared for them.
And we have a related question, Gertrude. It's what should families do if their child is failing a class or classes and needs a tutor or teacher support to help pass the class? And I think you were saying that the educators will be doing that kind of outreach. Is there anything else you would add?
Absolutely. They need to talk with their teacher about what supports they can get. They can talk with their school administrator and about what supports that are available. There are social workers and counselors and special educators who are available to our students to assist them. So all that can be navigated through the school. If they would just talk to the teachers or the administrators at the school, they can get the support that they need.
Well,
Brian?
Yes, go ahead.
I'd also like to add that as we've been planning all of the learning modules, we've also planned and been very intentional about planning for our special education students and our English second language students. So we have taken into consideration what IEP needs are, or individualized plans for our ESL students are, and teachers, our special education teachers and our general education teachers have been collaborating virtually. Our ESL teachers have been collaborating so that the lessons that are being pushed out has a sense of customization to them based on the needs of the individual students. We've also worked very closely with our private day providers for our special education students, and we're working hand in hand with them for the continuation of services that they provide and that are so vital for our special education students and for the families of those students.
And Dr. Atkins, I know how important you believe that work is for special needs students and English as second language, given especially Charlottesville's immigrant community. I guess that's also something a school division doesn't have a choice about. I mean, when we talk about equity, you have to find those solutions that apply to every student. I mean, talk about some of those challenges and what the expectations are coming down from the Department of Education.
Yeah, the Department of Education was very clear with all of us, and I don't think any of us would ever want to head in any other direction other than making sure that when we develop plans and we develop instruction, that we give careful consideration to the needs of our special needs students, ESL students. The Department of Education has clearly said that if we're providing new instruction, in which we are, that we must make sure that that new instruction is equitable and that we are providing the services that are necessary for our special education students. And that's what we're doing. It's a challenge, but we're doing that and providing those services. We also take into consideration the family needs, because our special needs students, some of them have very specific needs in the area of behavioral management and managing their day. In a classroom, we have more structure, more opportunity to provide the tools that help them to manage their day. So in this online virtual setting, we also have given attention to how do we provide our parents with some of those same tools and strategies and techniques, and so that they can help their student to use it, and the family members can use those strategies in helping the students manage and navigate their learning day.
I know some of the communications coming out of the Emergency Operations Center this week are going to be focused on mental health, and so we want the community to be looking out for those best practices. There's some simple tips that we can all do to stay healthy during this stressful time. One of the questions we're being asked right now on the webinar is from a parent who says, my child was seen by a Region 10 counselor during school hours. Can they still have those services provided during this time? I don't know if any of our panelists have knowledge about the Region 10 approach to mental health right now.
Brian, absolutely. What we'd like that parent to do is contact your principal or teacher, and we're going to get you connected to as many services as we possibly can. Region 10 is one of our strong partners, and they are coming alongside us as we look out for the mental health needs, the social emotional needs of our students. So please just contact your teacher. Teacher then will contact the principal, and we'll start making those connections.
And in a future episode of Cville360, we will be focusing on mental health resources in the community during the pandemic, so would ask you to tune into that probably next week as well. For the government geeks out there who are used to seeing local government make their own decisions about schools being open or closed, we think about weather emergencies and things along those lines. In this case, the governor has closed all schools through the end of the year. And so I guess a question for our leadership of the school division here is, it's sort of a basic question, but I don't know that I've heard it answered. Does a local school division have any choice right now about whether to offer new instruction? Could they just close the schools and say, that's all we can do right now, is keep everyone safe and at home, and we don't have the technology that a Charlottesville school division has? Does anyone know the answer to that?
Well, Brian, certainly in this time, there's some waivers that the State Department of Education will be giving to school divisions. There's a requirement that we have 140 hours of seat time for each one of our courses, and we're going to get some waivers around that. We'll get some waivers around the 990 hours. However, aside from those waivers, continuity of instruction is vital to all of our students. Our educational system is not set up to allow our students to miss such large chunks of educational time and then to be able to very easily pick up with the education after being away from it between 5 and 6 months. So with our special education students, once we start delivery of instruction, the expectation is our special education students, our ESL students, will receive instruction. If they don't, there is something called compensatory time that will kick in that school divisions are absolutely required to provide for our special education students and families. So that instruction will have to be provided at another time if a school division does not provide it now.
Thank you, Dr. Atkins. As we finish up today's program, I'd like to rotate through each of the panelists, just get some final thoughts about what the focus of your work is going to be in the weeks ahead, and any other information you really want to share with parents. And I'd also ask if you would share maybe any new habits or skills that you've picked up personally that you're going to use post-pandemic. Why don't we start with Kim Powell?
Thanks, Brian. I'm glad you circled back because I forgot to mention earlier that charlottesvilleschools.org/food is where anyone in our community can quickly access our latest information about how we're handling food distribution and meal distribution. So again, that's charlottesvilleschools.org/food. And that's also where people will find the links to sign up to volunteer if they'd like to help us in these continued efforts. And I really want to sincerely thank everyone who has supported us in our meal distribution work. Really appreciate it. If there's a family that needs meal support for their children, anyone age 18 and under, and our 22 bus stops and 5 feeding sites aren't working out for them, again, please contact the child's school, or you can contact our nutrition administrator, Carlton Jones, at jonesc1@charlottesvilleschools.org. We're happy to take suggestions. We have updated this plan and how we're approaching getting meals out into the community several times every week. It's constantly evolving, and we're trying to just make it as effective as it can be. So we welcome your feedback.
And Kim, we're all about lifelong learning, so any new habits or skills you've picked up that you think are going to persist?
Well, I've, let's see. I can't say that I've really changed habits that much personally. Social distancing, certainly, and I think I have every program on my computer that you can have for virtual meetings because everybody's using different platforms. I'm cooking a lot more at home because I was the queen of takeout and bringing things home. I'm still trying to patronize our local businesses that are open and bringing food home. So, but compared to, the amount of time I would spend working and then bringing food home, I'm cooking a lot more, for better or worse.
That's great. And let's go to Jeff Faust. Jeff, what can you tell us about your, focus in the weeks ahead and any skills or habits you've picked up?
Yeah, so obviously we talked about the device distribution, but we're also looking to provide internet access to those families that don't have it. So several local providers have offered some programs that are helping us get connected. But we're also providing hotspots. At this point, we're up to 103 households that we've been able to provide internet to through a MiFi style hotspot that they can use for anybody, any students in their household. And we even know that some of them are sharing it with their neighbors who live close proximity, where we have multiple families across 2 homes. So so we're going to continue to focus on that, making sure that, like I said before, our goal is 0. We want connectivity and planning for the future of looking at what could and might happen in the fall. We need to be ready for anything. And so we're going to continue to focus on that. And now our shift as we get devices and internet access to all of our families, we're going to shift towards supporting families, students, and teachers as everyone is learning new things and trying to keep up with the changes as they continue to provide the best of opportunities and learning for our students.
Thank you. Gertrude, Ivory, any final thoughts? And
Yes. Well, thank you, Brian, for this opportunity. All in all, our coordinators, administrators, our curriculum learning teams, continuity of learning teams, which includes our teachers and other staff, have done a phenomenal job in trying to provide instruction in a new landscape. And families and staff, we're asking for their feedback as we go forward, because we did a learning packet for students that would last about 4 weeks. So we will be continuing to look at what we're going to do for the remainder of the school year and probably sending another learning packet. And then for our students who are engaged in the online learning, we want the feedback to see what's working so that we can, as we go forward, make the changes necessary to meet the needs of our students and their families and our staff. And while we have a focus on teaching and learning during this time, we want everyone to have a laser focus on their safety and well-being. And so we want our students to certainly be safe, be well, follow the guidelines that they're supposed to follow. We want them to keep learning, because learning is important and learning will take them to the next step. And we also want them to keep in touch with us. I think that's one of the things that I've learned during this experience, that connecting with people is really important. So I've had longer phone conversations with people I may not have talked to for a long time, in a while, but the conversation goes longer. We talk more about things. We reminisce a lot. I'm trying to find some creative outlets during this time, doing my crocheting a little bit and making some things. So certainly we will continue to focus on how we can make instruction the best that it can be in this landscape and what we have to do as we move forward. But certainly keeping ourselves safe, well, and healthy is our priority.
Thank you, Gertrude. Those sound like great habits.
Thank you.
And Dr. Atkins, we'll finish up with you. Thank you for having your team share with us and give quite an impressive rundown of what the school division is doing. Any final thoughts?
Brian, I just want to thank you for having us, and a huge thank you to our principals and our teachers, our coordinators, and all of our staff, our custodian, nutrition workers, all bus drivers, all of our staff who have on a dime made a turn to embrace and to provide services in this unprecedented way, a very unique way. Moving forward, we are now concentrating on providing planning for summer. What will our summer experience look like? We will have summer school. The model that we're going to use is yet to be determined. And then to start planning about moving into the fall. We also need to now start looking at our budget. The governor released his budget. The General Assembly will be reconvening April 22nd to take another look at the state budget. Our city is also looking at their budget. So we will have to go in and make adjustments with our budget. So all of those are plans that we have to move forward and start thinking about what impact will all of that have on our delivery of instruction. New habits, I've learned how to do virtual conferences and communications. And I think what I'm learning more and more is the business of education. We think of it as an academic endeavor, but the foundation and the entire structure that puts education as a top priority in everyone's life is relationships. It's all about the relationships, and we're learning day by day how to engage with our students and our families in a unique and different way, but to send the message that we love them, we care about them, and we want to build strong relationships.
Thank you, Dr. Atkins. That wraps up today's episode of Cville360. Our next show will be on Thursday, April 16th at 4 p.m. We will get an update from Chief Baxter on our COVID-19 response, and we will be joined by Justin McKenzie, who manages the city market. He'll fill us in on last weekend's Market to Go event, and he'll tell us what we need to do to place an order for this weekend's market. Please contact me with feedback and ideas for future topics and guests. Thank you for watching, and please stay healthy.